Welcome to the EMT Spot's Blood Pressure Podcast. I'm Samuel Harrison,
And I'm Olivia Harper.
and we are going to take a deep dive into a question that might surprise you. What role does posture play in getting the most accurate blood pressure reading? You slouch, you stand, you cross your legs. Does any of that actually matter when that cuff squeezes your arm?
Oh, it matters more than you might think. We're talking potential for misdiagnosis, unnecessary medication, the whole 9 yards.
Wow.
To understand why we need to start with what's considered the gold standard for blood pressure measurement.
Okay, lay it on me. What's the ideal scenario?
Picture this. You're sitting comfortably in a chair, feet flat on the floor, back supported, and your arm is resting at heart level.
Okay.
You've been chilling for at least 5 minutes. No caffeine, smoking, or intense exercise for the past half hour. That's what the American Heart Association guidelines recommend.
Sounds pretty zen, but let's be real. How often does that actually happen in a busy doctor's office?
Yeah, you're right. It's rarely that idyllic. Most exam rooms are set up for efficiency, not blood pressure accuracy. You've got the cuff mounted on the wall. Maybe you're perched on the edge of the exam table, feet dangling. Not exactly a recipe for relaxation.
Yeah, I've definitely been in those exam rooms where you're practically hanging off the table to reach the cuff.
Right.
So what kind of impact does that have on the reading?
Well, research shows that when patients sit on the exam table with their legs dangling, their readings are significantly higher compared to sitting properly in a chair.
Higher meaning it looks like their blood pressure is worse than it actually is.
Exactly. And we're not talking about tiny, insignificant differences either. A study in the Lancet's eClinical Medicine found that readings taken on the exam table with dangling legs were a full 7 mmHg higher for systolic pressure
Wow.
and 4.5 mmHg higher for diastolic compared to sitting in a chair.
7 mmHg. That's not just a blip on the radar. That could be enough to push someone into a whole different blood pressure category.
Absolutely. Those seemingly small differences in millimeters of mercury can have a big impact on how your blood pressure is classified, which in turn affects what your doctor recommends for treatment.
Okay, this whole posture thing is blowing my mind. I always just assumed sitting was the standard. Is there any reason we don't check blood pressure lying down? I mean, wouldn't that be even more relaxing?
That's a great question, and it leads us to an interesting debate in the medical world. Is lying down what's called the supine position actually better for predicting long-term cardiovascular health?
So we're not just talking about getting an accurate reading in the moment, but understanding what it means for your heart health down the road.
Precisely. And the research on this is still evolving. Some studies suggest that supine readings might be more predictive of future cardiovascular problems, while others say stick with the sitting position.
So the science isn't settled yet.
Yeah.
Why is that? What makes studying this so tricky?
Well, there are many factors that can influence blood pressure, and it's difficult to isolate the impact of posture alone. Plus, different studies use different methodologies, making it hard to compare results directly.
Okay.
But one researcher, Dr. Stephen Jurashek from Harvard Medical School, has been doing some fascinating work in this area.
Okay, I'm all ears. What has he found?
He presented some really eye-opening findings at the American Heart Association's Hypertension Scientific Sessions. His research showed that having high blood pressure in both the seated and supine positions is definitely linked to negative health outcomes.
Go.
But here's the kicker. Having hypertension only when lying down was just as bad.
Wait, so even if my blood pressure is normal when I'm sitting, if it spikes when I lie down, that's still a red flag?
That's what the research is suggesting. It seems like we've been overlooking a crucial piece of the puzzle, and it could have major implications for how we diagnose and manage hypertension.
This is definitely making me rethink how I approach my own blood pressure. So given all this, what's the best course of action? Should everyone start demanding their blood pressure be checked lying down?
Well, Dr. Jurashek himself says we need more research before making major changes to clinical practice. But in the meantime, there are things both doctors and patients can do to improve accuracy, even with the time constraints of a typical visit.
What are some practical steps? I'm guessing asking my doctor for a 5-minute meditation break before my reading might not fly.
Probably not, but a doctor named Dr. Wexler suggests something simple, having patients fill out paperwork in the exam room rather than in the waiting area.
Oh,
That way they have a few minutes to de-stress before the blood pressure cuff even comes out.
that's brilliant. A simple tweak to the routine that could make a real difference. Any other tips?
Both Dr. Wexler and Dr. Jurashek agree that home blood pressure monitoring is likely the most accurate way to go. It gives you much more control over the environment and allows you to take multiple readings at different times of day, painting a more complete picture of your blood pressure patterns.
Home monitoring. So I could be in my pajamas, feet up, and get a super accurate reading. Sign me up. But isn't there a right way and a wrong way to do it? I wouldn't want to mess that up too.
You're right to be cautious. It's important to talk to your doctor about proper home monitoring techniques. They can help you choose the right equipment and make sure you're using it correctly.
Makes sense. So just to recap, posture has a huge impact on blood pressure readings.
Yeah.
And even seemingly small differences in how we sit or lie down can affect the numbers.
And it's not just about getting an accurate reading in the moment. It's about understanding how your blood pressure fluctuates throughout the day and what that means for your long-term health.
This has been incredibly eye-opening. I feel like I've learned more about blood pressure in the past few minutes than I have in my entire life. But before we wrap up this part of our deep dive, I want to leave you with something to think about. If inaccurate readings can lead to overdiagnosis, could they also lead to underdiagnosis? Could some people be walking around with undiagnosed hypertension simply because their readings were consistently off?
That's a thought-provoking question and one that we'll explore further in our next segment.
Stay tuned. This is the EMT Spot's Blood Pressure Podcast. We'll be right back.
Welcome back to the EMT-Spot's Blood Pressure Podcast.
Before we went to our quick break, we were talking about how inaccurate blood pressure readings could potentially lead to underdiagnosis of hypertension. Kind of the flip side of what we were discussing earlier.
Yeah, it's definitely a valid concern. Imagine someone consistently getting their blood pressure checked in a position that throws off the readings, like with their legs dangling off the exam table.
Their readings might be artificially low, masking the fact that they actually have hypertension, and they could be going about their lives completely unaware of a potentially serious health risk.
Exactly, and that's what makes this issue so crucial. Untreated hypertension is a silent threat, increasing the risk of heart attack, stroke, kidney disease, and a whole host of other problems down the line.
It's a scary thought, like a ticking time bomb.
Which is why awareness and accurate measurement are so important. Both patients and healthcare providers need to be vigilant. We've got to catch those cases of hypertension that might otherwise slip through the cracks.
So let's talk solutions.
Mm-hmm.
What can we do to reduce the risk of both overdiagnosis and underdiagnosis? It seems like we need a way to make sure everyone's playing by the same rules when it comes to blood pressure measurement.
Absolutely. Standardizing those techniques is essential. Healthcare providers need to be following the guidelines rigorously, using the correct cuff size for each patient, making sure the patient is positioned correctly, and allowing for that all-important rest period before taking the reading.
Those 5 minutes of quiet time really do seem to be more important than most people realize.
They really are. And it's not just about what happens in the doctor's office. Encouraging home blood pressure monitoring is also crucial. It can help catch both high and low readings that might otherwise be missed during a single office visit.
Home monitoring is such a game changer. It gives you so much more data to work with, a much clearer picture of your blood pressure patterns throughout the day.
And it empowers patients to take an active role in managing their own health, rather than just relying on a single reading once a year at the doctor's office.
Speaking of taking an active role, what about lifestyle changes? Can those make a real difference in managing blood pressure, whether you're already diagnosed with hypertension or just trying to stay healthy?
Lifestyle modifications are often the first line of defense against hypertension, and they can make a significant difference. We're talking about things like eating a heart-healthy diet, reducing your sodium intake, getting regular exercise, maintaining a healthy weight, and limiting alcohol consumption.
All the good stuff we hear about all the time. But sometimes it's hard to actually put into practice. Any tips for making those changes stick?
It's about finding what works for you and making gradual, sustainable changes that become part of your routine rather than a temporary diet. For example, instead of overhauling your entire eating plan overnight, maybe start by swapping out sugary drinks for water or adding an extra serving of vegetables to your dinner each night.
Small steps that add up over time. I like that approach.
Exactly. It's also important to find an activity you enjoy so exercise doesn't feel like a chore. Maybe it's dancing, hiking, swimming, or just taking a brisk walk in your neighborhood. The key is to make it fun and something you look forward to.
This is all great advice. It's really empowering to know that we have so much control over our own blood pressure, even beyond just how we sit during a reading.
Absolutely. It's about taking charge of your health and being proactive.
So looking ahead, what's the future of blood pressure management? What exciting advancements are on the horizon?
I think we're moving towards a more personalized and data-driven approach. We're seeing amazing advancements in technology like wearable blood pressure monitors that can track your readings continuously throughout the day, giving you and your doctor an incredible amount of information to work with.
That sounds like something out of a sci-fi movie. continuous blood pressure monitoring. It's mind-blowing.
It really is. And with the rise of telehealth, patients can share those readings with their doctors, remotely allowing for more frequent monitoring and adjustments to treatment plans as needed, all from the comfort of their own homes.
It's all about staying connected and being proactive, rather than just waiting for things to go wrong.
Precisely. And as research continues to unravel the complexities of blood pressure, we can expect even more innovative approaches to diagnosis, treatment, and prevention.
It sounds like the future of blood pressure management is bright. But before we get too ahead of ourselves, let's get back to the basics. We've talked a lot about the potential for both underdiagnosis and overdiagnosis, but what are some specific examples of situations where posture might really throw off a blood pressure reading? What should our listeners be looking out for?
So we were talking about those real world scenarios where, posture might actually give you a blood pressure reading that's way off.
Right, because it's one thing to understand the theory, but then you walk into a doctor's office and suddenly you're like, wait, where do I put my arms? Do my legs dangle?
Exactly. So let's say I'm at the doctor and they tell me to just sit on the edge of the exam table for my blood pressure check. My feet aren't touching the floor. I'm kind of leaning forward to reach the cuff. Red flag. Oh, huge red flag. Remember that study we talked about in the Lancet Clinical Medicine? Dangling legs. Yeah, way higher readings.
Right, 7 mmHg higher for the systolic and 4.5 for diastolic. Not a small difference.
Not at all. And if you're leaning forward, your arm might not be positioned right at heart level, which can also mess with the reading.
Okay, so what should I do in that situation? Politely request a chair.
Absolutely. Don't be afraid to advocate for yourself.
Oh.
You could say something like, would it be possible for me to sit in a chair with my feet flat on the floor for this? I just want to make sure we're getting the most accurate measurement possible.
Yeah, I love that. It's direct, but it's also respectful.
What about other situations? Like, let's say I'm at a health fair and they're using one of those automatic cuffs at a kiosk.
Those can be a little tricky. You want to make sure the cuff is the right size for your arm and that it's positioned correctly. If you're not sure, just ask the person doing the test.
Yeah, good point. It's easy to just assume they know what they're doing, but better safe than sorry.
Right.
Exactly. And remember, even if you get a high reading at a health fair or something, it's important to follow up with your doctor. A single reading doesn't automatically mean you have hypertension. They can do more tests over time, with the proper techniques to really see what's going on.
Okay, this has been so informative. I feel like I'm armed with all this blood pressure knowledge now, ready to be an advocate for myself and for others.
I love that.
But before we wrap up, I want to circle back to something you mentioned earlier. Those wearable blood pressure monitors. Tell me more about those. What's the deal with continuous blood pressure monitoring?
Oh, it's such a cool development in blood pressure management. These wearable monitors, some of them are actually already out there. They use sensors to track your blood pressure all day and night. No cuff needed.
No way.
Yeah.
So I could see how my blood pressure changes when I exercise, when I'm stressed, even when I'm sleeping.
Exactly. You get so much detail. You can see patterns and trends that you might not even notice otherwise. Like maybe you'll discover your blood pressure always goes up during your morning commute, or that it goes way down after you do a certain type of exercise.
That's amazing. It's like having a 247 blood pressure diary.
That's a great way to put it. And that data can be so helpful for you and for your doctor. You can make better decisions about lifestyle changes, medications, and just your overall treatment plan.
So it sounds like wearable monitors are a big step forward in personalized blood pressure care.
They really do have the potential to change the game when it comes to hypertension. Of course, like with any new technology, there are still some kinks to work out, like making sure they're accurate and reliable. But so far, the results are really promising.
Wow. Exciting to think about all this. Well, Olivia, this has been such a fascinating deep dive into the world of blood pressure and posture. I feel like I've learned so much, and I hope our listeners have too.
It's been a pleasure, Samuel. I could talk about blood pressure all day.
I know, right? And to all our listeners out there, thank you so much for joining us on this journey. Remember, knowledge is power, and understanding your blood pressure is absolutely crucial for your health.
And if you found this deep dive helpful, please subscribe to the EMT Blood Pressure Podcast. Like, comment, share it with anyone who might be interested in learning more about their health.
We've got so many more great topics to cover in future episodes, so stay tuned. Until next time, be well and take care.